Hi everyone, finally results are out and hearty congrats for all those who have excelled in exams. I want to give a few suggestions for a better internship. First thing is, internship is a very one of the very tough times in our medicine career. In these tough times, it's important to protect our health, because in UG you had enough time to sleep, to eat food, and to take holidays when you felt drowsy or tired. But in internship, you don't get enough holidays whenever you want, and sleep and food are completely not in your hands. So it becomes very important to maintain your health. And the internship duties sometimes are very hectic, sometimes even 48 hours. So you will be running around the patients to get the scans done, or in the ward, in your ICUs. So I mean to say, in this hectic schedule, we may not get enough sleep hours, and we may not eat good food. So prioritize your sleep, especially between duties. When you don't have duties, take more time to get good sleep, and avoid decrease your phone usage, especially the web series or reels. You cut down the time on them and take good sleep, take more healthy nutritious food, and please don't miss out on workouts. Workouts are very important to keep you going. You may not get time, especially due to duties, but still go and do workouts or play games at least 3 to 4 days in a week. So that is for the health. And second thing is the internship, the practical experience of internship. Many people complain that in internship, after some duties, it is regular monotonous work. Sometimes we are given work which is not very knowledge gaining work, which is just going around the patient and getting the scans or investigations done. You may have to go through these things. For those things you may hate internship, but I mean I suggest you to gain all the practical experiences which you gain from internship, because internship is that phase of life where you get exposure to most of the departments in your medical field. Those departments may not be relevant to you in your post-graduations, some departments, but most of the departments, knowledge what you gain from your internship will be helpful directly or indirectly in your practice. Directly in the sense, if you are a surgery resident, if you know about the medicine, the management of diabetes or thyroid, you will be incorporating in your practice. If you are ophthalmologist and you get a case of orthopedics, you may not be that may not be helpful in your direct practice, but indirectly you can guide a patient. You can guide someone calls you, your relatives or your friends or your parents. So any knowledge when you gain through internship, it will be helpful in your career. So you will be more multifaceted in sending the patient to certain departments if you have knowledge of other departments. And these things you will not get only by reading the NEET preparation. So don't miss on these experiences. And how when you treat a patient, or when you are with the patient, when you see the pain, the suffering, then a lot of changes happen in you. You may feel empathy, you may feel and you may have a lot of problems in your life, but when you see their life in front of you, a lot of people suffering multi-organ failure or multiple fractures, you may feel what problems I have are very little compared to them. So you may get insights into your life, the subtle problems or small problems may not bother you much. So these insights will not give, the books will not give. Your practical experiences gives these insights. So don't miss on them, and because they will help you to grow as a person. And how to gain knowledge in internship, because when you go to a department to get a scan, or when you are in your department seeing the cases, BP, monitoring the BP or recording the BP, don't do just those work which is told to you. Go beyond a step beyond it. Open the case sheets, look into the file, what all cases things patient has gone through, are his investigations done, whether the investigations and the clinical diagnosis are matching, what all treatment he is taking, then you can learn through them. And when you are referred to other departments for investigations or scans, like example varicose veins in radiology department, you can go there, you can ask the radiologist there to teach you, to make you understand what they are marking, what they are doing with the scans. So that will help you even in your NEET, because you will be now in these days NEET questions are more of practical based questions. The points and the question module is shifting towards practical based things, so that will give you insights, image based things. So just take a step further to get more information than just to do things which are told to do. So for that you need to have a lot of energy, which I told you earlier, to have a good health. So that will give you energy to get the knowledge in your duties too. It also helps in choosing the subject, because sometimes we may think I'm a good orthopedician or I'm a good pediatrician, but that those are assumptions. When you go there, when you treat the patient, when you know how the things are done there, then you will know will I be able to fit in that profession or in that subject or not. So those things you'll know only when you go there and be or imitate the pediatrician or the dermatologist. So it will help you in choosing a subject, and the subject choosing is very important, because the subject stays till your entire career. You can't change subject, you all know that. So I sincerely suggest that take your internship, attend all the internship departments and visit all the departments, do the work and learn from them, and understand different subjects. And coming to NEET preparation, you should do it simultaneously along with internship. Once in a while, because of hectic schedule, you may not get time, but most of the time you can extract time in your internship busy duties too. When you see a case, example diabetes ketoacidosis or post-op ward electrolyte imbalance, go and study. If you see a case of gastrectomy or subtotal or total gastrectomy, go and read. So like this, the practical things and the theoretical things, you should merge those things, and that will increase your knowledge about medicine. So you will become enriched, will become more enriched in the knowledge. That will help you obviously in NEET and in your future post graduation also. So become that. So and don't waste time on other things. Coming to time, you can party, you can hang out with friends, you can do other things, but see to that you don't spend too much time on them. Try to balance out on time. Okay. And coming to finances, so you may be getting the first salaries in your internships, you feel like little satisfaction, contentment. So your family, in middle class families, they may feel that abhi hamara bacha is earning, so he is like unke pav mein wo khada ho raha hai, or they are trying to stand on their own. So then these things will be automatically in our families going on. So sometimes we may feel painful to ask our parents, especially during PG preparation. So I mean, hold the money, spend it wisely, keep the money for your PG preparation. Sometimes we may get swayed because we may have some things, desires in our UG. In UG we may not have money to fulfill those things. We may, as we have money, we want to buy things like shoes or clothes or something. So now think, are we going to use them? If I buy new 2 to 3 pair of shoes, am I going to use them or not? Am I going to wear that new dresses in my PG preparation or not? So balance out on these things. So then because those few thousands you are going to spend here will be very precious in your PG preparation. So just spend judiciously. I'm not saying not to spend at all. You can enjoy, celebrate, but spend judiciously. And coming to friends, you may not in your usually you had a lot of friends available to talk to you, meet and share things, even your birthdays, but now you may not get time of other friends because their schedule of duties may not be in like matching with your so take time to spend with friends. So meet friends, discuss, share your happiness and pain, so that you will have a good group of cushioning people, so that they will be helpful to you and you may be helpful to them. So build or else bridge those relations to a better like into a better relations. We may have a lot of friends in our first year, second year, that those group of friends will decrease. So at least because of that, I suggest you to play games and interact with seniors, juniors. So you will have good amount of friends that's even helpful, or else cushioning when you go to your own practice after like few years. And relations in internship, you may get acquaintances or closeness with many people, because you have duties with different group people or different college people coming to your college. So you may share time, you may talk to them. So sometimes don't be in bubbly world or dreamy world, like if that girl or that boy is close to you, like dreaming about things and living in some clouds. So be aware where you are, and so analyze things. Is that person really caring me, or is this person really the person whom I want to be with till my life? So think about these things, and based on that take decisions, or else you will be swayed away with these things. So and it will be very difficult, because after this you will enter into PG preparation phase. In that phase, even if you will that's even more tougher phase. So this internship should be a preparation for that. So balance on things, so plan things, and take care of yourself and your friends, family or friends. So this is from my side. Thank you for very much for your patient listening. Have a great internship and medicine life. Thank you very much. Please like, share and subscribe.